The SLE Quality of Life Questionnaire was chosen for Antoinette to be used as the assessment tool. It was developed by rheumatologists and nurses, and it also incorporated input from patients who suffer from SLE and what out of I think 100 items, which one were the most important and significant to them. So it has 40 questions, and it's a self-report that the patient answers with no help from anybody else. And it doesn't, the people who developed this assessment tool, for scoring, they just stated that there's a minimum of 40 points that you can get, and then maximum of 280. So the higher or closer you are to 280, that shows like how the quality of life is impacted by SLE. So for the purpose of this video, I'm going to be asking Antoinette all of the questions just to show what they cover and to show how the assessment will be done, but usually it will be done in a quiet setting by herself, just answering the questions, and it's asked about what her life has been in the past week, so it's most up to date and current about her situation that is going on right now. Hi Antoinette, I'm Stephanie. I'm going to be your OT today. So today I'm just going to do an assessment with you. You're going to do a self-report, and it's just basically going to ask you a bunch of questions about activities and your feelings since your diagnosis with SLE. All right?
Okay.
So it's about 40 questions. If you ever get tired or need a break, just let me know. Okay?
Okay.
Does that sound good?
Perfect.
So based on these results, we'll be able to determine what to focus on in therapy, because I know you want to get back to taking care of your children and getting back to work, right?
Yes.
Okay. So the first set of questions is based on 1 through 7, 1 being not difficult and 7 being extremely difficult. Okay? So how difficult has each of these activities been in the last week as a result of your SLE? Walking outdoors on level ground.
That's hardly difficult.
Okay. Shopping.
Shopping is somewhat difficult.
Okay. Turning faucets on and off.
Hardly difficult.
Okay. Going to the grocery store.
Moderately difficult.
Mm-hmm. Bathing and drying yourself.
Hardly difficult.
And walking about 2 miles.
That's quite difficult.
Okay. All right. So the next part, it's going to be 1 through 7 again, and 1 is not troubled, and 7 is extremely troubled. Okay. So how troubled have you been in the last week by each of these social or occupational activities as a result of your SLE? Work and school performance.
Very troubled.
Okay. Interference with your career or education.
Quite troubled.
Missing work or school.
And extremely troubled.
Relationship with friends and relatives.
Moderately troubled.
Taking part in sports.
Somewhat troubled.
Taking part in social activities.
Quite troubled.
Okay. Unable to go out into the sun.
Somewhat troubled.
Making less money because I have SLE.
Very troubled.
Okay, so the same scale. How troubled have you been by each of these symptoms but in the last week as a result of your SLE? Poor memory.
That is hardly troubled.
Loss of appetite.
Somewhat troubled.
Fatigue.
Extremely troubled.
Poor concentration.
Moderately troubled.
Itchy skin.
Very troubled.
Sore mouth.
Hardly troubled.
And sore, painful, or stinging skin.
Moderately troubled.
And then the last, joint and pain swelling.
Extremely troubled.
Okay. So we're almost finished. You're feeling okay?
Yeah.
All right. So we're still going to use the 1 through 7, and it's going to be 1 is not troubled and 7 is extremely troubled. So how troubled have you been by each of these problems related to medical treatment in the last week as a result of your SLE? Fear of needles?
Not troubled at all.
Okay. Dietary restrictions?
Somewhat troubled.
Inconvenience of daily medication?
Moderately troubled.
Okay. Inconvenience of frequent clinic visits?
Very troubled.
Okay. So now this next set of questions is based on the scale 1 to 7, not at all, and 7 is extremely often. So how often during the last week have you been troubled by these emotions as a result of your SLE? Self-consciousness?
Quite often.
Okay. Feeling low or down?
Very often.
Depression?
Somewhat often.
Anxiety?
Anxiety. Quite often.
Okay. So it's the same scale 1 through 7. How often in the last week have you been troubled by these feelings as a result of your SLE? I wish that other people did not know that I have SLE.
Quite often.
Being made fun of by my friends and colleagues.
Not at all.
Low self-esteem.
Moderately often.
Embarrassment about my SLE.
Somewhat often.
Concern about the financial burden to my family.
Very often.
Concern that medicines do not work.
Somewhat often.
Concern about side effects of medicines.
Very often.
Fear of receiving bad news from doctors.
Extremely often.
Consuming more alcohol or tobacco.
Not at all.
Okay. All right, great. That wasn't too bad, right?
Not at all.
Okay. So we'll take these scores and we'll address the most areas that you had trouble with and try to work on that for therapy, all right?
Okay.
All right, I'll see you next time.
Thank you so much.
Yep. Okay, so in order to score this assessment, there's no manual on this assessment, but the article that's given about how it was developed, the authors state that scoring, you just add up all the scores that when you're finished with the assessment. So the scores could range from 40 to 280. The closer to 280 means there's more significance in the impact of SLE on the quality of life. So you're just going to add up all the points in each section. So we would add 2 plus 3, oh wait, let me start over. 2 plus 3 equals that, plus 2 plus 4 plus 2 plus 5. So that equals 18. So then you would do that for the next section, and you would just keep going. So you would do this for each of the sections. So the next, she got 43, 37, and so on. And her final score ended up being 164 with the possible score of 280. So you can see from her score that that SLE is having an impact on her quality of life. And that is how you score the assessment.